How do you use a bladder diary for bladder control? Imagine having a simple tool that helps you understand your bladder habits and take control of your urinary health. That tool is a bladder diary, a straightforward record that can make a big difference in managing bladder issues. Whether you're dealing with frequent urination, urgency, or incontinence, or you're undergoing treatment for bladder cancer, a bladder diary offers valuable insights. It helps you and your healthcare provider see patterns and triggers, guiding personalized treatment plans. A bladder diary is basically a detailed journal where you log your urination habits over a period of 2 to 3 days. You record the exact times you go to the bathroom, whether during the day or night. If possible, use a measuring cup to note how much urine you pass each time. This gives an idea of your bladder capacity and helps identify if you're urinating more often than normal. You also note how strong the urge to urinate was before you went and whether you experienced any leakage or incontinence episodes. It's helpful to record what you drink, including water, coffee, tea, alcohol, or other beverages, and how much you consume. This can reveal if certain drinks are affecting your bladder. In addition, jot down any symptoms like pain or discomfort during urination, or activities that seem to trigger symptoms. For example, if you notice more urgency after drinking caffeine or alcohol, that's useful information. Be consistent and fill out the diary for at least 2 days, preferably 3, to get a clear picture of your typical habits. Some healthcare providers might suggest longer periods if needed. Using a bladder diary is especially helpful for people working on bladder training techniques. For example, if you're trying to increase the time between bathroom visits, tracking your habits helps you see progress and identify patterns. It also helps your healthcare team recommend lifestyle changes, such as reducing fluid intake before bed or avoiding irritants like caffeine and alcohol. For those with bladder cancer, a bladder diary can help monitor symptoms and evaluate how treatments like surgery or radiation are affecting your bladder function. A key benefit is that a bladder diary provides a baseline. If you start pelvic floor exercises, medications, or other therapies, keeping a diary allows you to see if your symptoms improve over time. Sometimes, just becoming more aware of your habits through the diary can lead to better control and less urgency. Remember, though, that a bladder diary is a tool to support your care, not a substitute for professional medical advice. If you notice blood in your urine, persistent pain, or significant changes in your urination habits, it's important to consult your healthcare provider promptly. In summary, a bladder diary is an easy, effective way to understand your urinary habits and identify factors that influence your bladder health. By tracking your urination times, fluid intake, and symptoms, you empower yourself to work with your healthcare team to develop the best management plan. Always seek personalized medical advice to address your specific needs, and remember that a bladder diary is just one step toward better bladder control and overall health.